The ICF Training and Technical Assistance Team is honored to welcome you to this California Housing and Community Development training session offered through the Emergency Solutions Grant Coronavirus Consulting and Staffing Services Contract. I'm Chris Pitcher from ICF, and I'll be hosting today's session. Today's training session is entitled Homelessness 101. Let's look at the learning objectives for today. It is my privilege to introduce you to today's first presenter, Mindy Mitchell.
Hi, everyone. Welcome to the series. Today's session is Homelessness 101, and we can go to the next slide. This session is designed for staff who may be working on homelessness for the first time to provide a basic foundation on the topic. This session will be followed by another, Homelessness Programs and Services 101, which will provide more detailed information about homelessness interventions and best practices. So in today's session, you'll gain a better understanding of the following topics: the causes of homelessness, definitions of homelessness, strategies to address homelessness, partners in addressing homelessness, how you measure success in ending homelessness, and finally, partnering with people with lived experience. To begin, let's talk about what causes homelessness and how it's defined by various laws and different agencies. So the cause of homelessness is actually not that complicated. Homelessness happens when how much housing costs is more than what someone has to pay for housing. Homelessness is fundamentally a function of poverty and the lack of affordable housing. According to the National Low-Income Housing Coalition's annual Out of Reach report, there is no state in the country where people working at the federal minimum wage can afford fair market rent, even if they work 2 full-time jobs in most states. So homelessness is fundamentally about affordable housing, but other factors can increase the risk that someone becomes homeless. In our work, we must also consider the effects of historical and ongoing structural racism that leads to disparities in poverty among Black, Indigenous, and other people of color in this country. That structural racism also leads to widespread housing discrimination and segregation that still combine with disparities in poverty to create disparities in homelessness. Another factor that can contribute to homelessness is health issues and the lack of access to affordable health care, which is itself inequitable. Again, due to historical and ongoing structural racism and racial health disparities. Many households are only one healthcare crisis away from not being able to pay the rent or mortgage. Additionally, once someone becomes homeless, that situation itself causes health problems and can create a revolving door in and out of emergency rooms and back to the streets. Mental and behavioral health issues can also be a contributing factor to homelessness, including serious mental illness and substance use disorders, often co-occurring. Additionally, interpersonal or domestic violence can lead to someone losing her housing, as can becoming involved with the child welfare or criminal justice systems. And again, those two systems particularly have a long history of structurally racist impacts and contribute to the racial disparities we see among people experiencing homelessness. Finally, family conflict can lead to people losing their housing, especially among youth and young adults. But you must always keep in mind that these risk factors are situations that happen to people from all socioeconomic backgrounds, and they never become homeless, which is because they have the resources to ride out these kinds of life crises. And even most people with very low incomes never experience homelessness. So the only real cause of homelessness is, as we said in the beginning, a mismatch between how much housing costs and how much someone has to pay for housing. And that should really inform all of our responses to homelessness, as we'll talk about a little later. Now, we'll talk about definitions of homelessness. So some of you may have heard advocates talking about the McKinney-Vento definition of homelessness, but there are actually 2 definitions in the McKinney-Vento Act, which is the main piece of federal legislation that addresses homelessness in this country. But before we get into definitions, I want to tell you why there are different definitions, even in this one piece of legislation. As you may remember from civics class or Schoolhouse Rock, Congress makes laws, the Supreme Court interprets laws, and the president enacts laws. So, whenever Congress or any legislative body makes a law, there's always a section that provides definitions to tell the president and the federal agencies that she directs and the courts what Congress means when it says a particular word in a particular part of a law. So, in the case of the McKinney-Vento Act, there is a section that provides a program for the Department of Education and one that provides programs for the Department of Housing and Urban Development, or HUD. Now, in this country, every child has the right to a free public education, but unfortunately, we do not have a similar right for housing. Therefore, because education is a public right and housing is a finite and under-resourced uh, solution, Congress made the definitions of homelessness for those two agencies different. The education definition is more expansive and includes people who are not without housing. So the HUD definition, on the other hand, includes the following categories of people. First is those who are literally homeless. That is, they are unsheltered, living outside, or in places not fit for habitation, or they are currently staying in an emergency shelter. Second is people who are imminently homeless or less than 2 weeks away from not having anywhere else to stay. Next is people who are defined as homeless by other laws, like the education definition, but who can stay safely where they are for 2 weeks or longer. And finally, we have people who are living in or fleeing unsafe situations like domestic violence or human trafficking. So, as you can already see, the HUD definition does include all those other definitions. So, it's not really about definitions, it's about eligibility. Now, I won't spend much time on this flowchart because, like all things involving billions of dollars and large bureaucracies, it's complicated. But eligibility for HUD homelessness assistance is determined by finding out what a person's current living situation is, and then based on that living situation, directing that person to the resources that she's eligible for. So, as you can see in this chart, the highest priority is first determining whether someone is safe. Then it's about whether someone is currently in housing or not. And if so, how long that housing is available. The broader definitions, like the education definition, don't ask how long someone can stay in housing, but for the limited housing resources from HUD, you can see that eligibility is most limited for those folks who are in Category 3 and can stay safely in housing for 2 weeks or longer. And just for further clarification, Category 3 of the HUD definition includes people who are defined as homeless by other laws, but who can stay safely where they are for 2 weeks or longer. This includes people who are couch surfing or doubling up at someone else's place for longer than 2 weeks, or people who are living in motels and can pay for their own stay for longer than 2 weeks. It also includes people who are living in sober living homes. And in this slide, you can see just some of the other definitions from other federal and California laws that will be relevant for addressing homelessness in California. Finally, the definition of chronic homelessness may not come up in most ESG work, but we wanted to mention it so that you are aware of it because it's another definition that can determine eligibility for certain housing interventions that we're going to talk about later. The simplest way to think about chronic homelessness is that people who are experiencing it must have a disability. They must be unsheltered or in emergency shelters, so literal homelessness. And they must have experienced homelessness for a long period of time, like at least 1 year or multiple times over the past 3 years. The most important thing about people experiencing chronic homelessness is that while they are a very small part of the homeless population, they are highly vulnerable because of their disabilities and because they're usually unsheltered. And being unsheltered itself is so unhealthy. So, with these folks, there are high public costs when we don't address their homelessness. And how do we address homelessness? That's what we're going to talk about next. So hopefully this won't be a big surprise, but because homelessness is a problem of housing, the solution to homelessness is housing. And that's the foundational belief of the philosophy of Housing First, which informs all HUD and California funded homelessness programs. Now, housing first doesn't mean housing only. It just means that we acknowledge and honor that housing is a basic human need and that people shouldn't have to be housing ready before we help end their homelessness. They are ready for housing by virtue of not having any. And from that foundation of housing, they can address whatever life issues they decide they want to address. Now, that can be one of the most difficult things about Housing First that many of us struggle with, that services in Housing First programs are voluntary. But that is also one of the most profound and important parts of Housing First. While we are all coming from a good place and wanting to help people, the provider client relationship is an inherently unequal one. But Housing First and voluntary services shifts that power dynamic. It puts the person experiencing homelessness in the driver's seat and shifts the burden for service engagement to the provider. And while that shift can be a difficult one to make, the evidence for Housing First and its focus on getting people into permanent housing as quickly as possible is really strong. So it's not only the right thing to do by people experiencing homelessness, it's also the most effective thing at the provider and the system levels to end homelessness in our communities. The two most important housing first, sorry, you can go back. The two most important housing first interventions in most communities are the permanent housing interventions of rapid rehousing and permanent supportive housing. So you'll learn more about these interventions in the next session. But for now, I'll just say that rapid rehousing provides short to medium term rental assistance with housing identification and case management services. While that rental assistance does not go on forever, the housing itself is permanent housing because it's the client's own housing that she can choose to remain in as long as she likes after rental assistance ends. Permanent supportive housing, or PSH, on the other hand, provides a permanent housing subsidy, usually a voucher, plus intensive and often on site services. For those reasons, PSH can be very expensive and should be targeted to people experiencing chronic homelessness or to people who have otherwise serious and substantial barriers to stability that require that level of intervention to prevent returning to homelessness. Now, in addition to permanent housing interventions, communities need to have a lot more in place to effectively end homelessness. And that's why you'll hear so much talk about a systemic response to homelessness. This just means that all the programs and agencies and funding streams in the community that can assist people experiencing or at risk of homelessness are coordinating their work towards a common goal of ending homelessness. This creates a crisis response system that ensures that when someone becomes homeless, there is an immediate, accessible option for them to avoid being unsheltered. And by examining our data and analyzing the difference that increasing the amount of permanent housing makes, we can also right size our temporary housing interventions like shelter and transitional housing, which are often much more expensive, especially in the case of transitional housing, than just getting people into permanent housing. A really important part of an effective and efficient crisis response system is helping people to never enter the homelessness system in the first place. So this should include robust diversion services that you'll learn more about in the next session, which helps people avoid shelter by remaining in or returning quickly to their most recent housing situations. Carefully targeted prevention is also an important piece of the puzzle that you'll learn more about in the next session. But for now, I'll just say that it's important to understand that eviction prevention and homelessness prevention are not the same thing. Most people who get evicted never become homeless. So, to be sure that we're spending our scarce homelessness resources most efficiently and effectively, prevention should be targeted to people that are most likely not to be able to avoid homelessness on their own. Finally, as I said before, the evidence for housing first and permanent housing interventions like rapid rehousing and permanent supportive housing is really strong. Most people who receive these interventions don't return to homelessness, even people that we make assumptions about because of their perceived barriers to housing stability. Housing first is also the smart approach from a systems perspective because housing is much more efficient and effective way to end homelessness. Related to that, lowering barriers in shelter and focusing on rapid resolution or getting people out of shelter and back into housing quickly, both of which are another part of being housing first throughout our system. That approach allows more people to enter and then move on from shelter quickly, which creates better system flow. And this is just similar points to the last slide. Be sure to check out the links on both of these slides when you get the PowerPoint for lots more information about the effectiveness of housing first. But I'll end with this last point here, that foundational philosophy behind housing first. Housing is a basic human need, and it should be a basic human right. We focus on housing to address homelessness because housing is the foundation from which we all address the inevitable life issues that come up in our lives. People experiencing homelessness deserve that same foundation, and Housing First provides that. Now, my colleague Karen will talk about some other important strategies for ending homelessness, building partnerships, and measuring performance.
Thanks, Mindy. So we're just going to pause for a few seconds in the presentation to have you all do an interactive part, if you will, and thinking about who are our partners in ending homelessness. So I'd encourage you to just take 5 seconds and maybe jot down or just think of 3 partners that you know of that can help end homelessness. So let's start talking about who some of those partners are. So I'm going to start off with just a few critical large partners that we see as effective in ending homelessness. So the first one is a continuum of care. So what is a continuum of care? Some of you may know continuums of care from other sectors like healthcare and things like that. But for the homeless sector, a continuum of care is really a formal structure created by HUD to help manage homeless assistance at the local or the community level. Continuums of cares, or COCs as we affectionately call them, they encompass a specific geographical area. So this could be a county. Most of California is their COCs are based on counties. It can be multiple counties. In some places, it's an entire city or an entire state, and in other places, just parts of the state. So a big state like Texas, they have a few large COCs, and then the rest of the state is called the balance of state. So what a COC really does is a means of governing and having shared decision making. So this can also be shared decision making in funding, prioritization, performance, things like that. And this made up of a lot of different organizations and people who are interested in solving homelessness in the community. So a COC can look very different in its makeup from one location to the next. Every COC has what we call a lead entity, and they help coordinate all these plans. They're often a primary point of contact when someone wants to know, how do I solve homelessness in this particular area? In many places, we see that as some sort of government entity. It could be a county entity, it could be a city office, it could be a variety of government entities, but we also see a lot of nonprofits who are seen as lead entities, and they usually also have very strong connections to their local government in order to implement homeless resources. So the second partner I wanted to talk about was healthcare. So many of us have heard for many years that this partnership with housing and healthcare is essential, right? Because as Mindy already talked about, we do see cycling between various systems of homeless individuals, and healthcare is one of them. Homeless folks go to emergency rooms because they're not engaged in primary care. They may stay there for a long time, which can be very expensive, and then they leave the hospital and they move right back either to the street or the shelter. So one way to end this cycle is to really partner with the healthcare system. And healthcare, I think, has learned over the years that housing is the solution and is a form of healthcare, because we see physically. I remember when I was working with clients, they would be housed and you can physically see a change in their appearance after a few months of just being in housing because they're stable. Their stress is reduced. They're not worried about where they're going to sleep every night. They're not worried about what they're going to eat. These partnerships with healthcare often start with just simple data sharing and understand the overlap between these two populations. And so we see that we really are serving the same folks. And then we've been moving our healthcare friends to investing in housing and services. So we see in various parts of California and various parts of the country where healthcare is really making a monetary investment in housing. And the other thing we're really finding, whether there's a monetary investment or not, is that many of the folks with high barriers or high needs really do need a team approach to address those barriers. So folks need support in staying in housing, which they can get through a housing provider, but they also need mental or behavioral health supports in order to remain housed. So many folks have like a team helping them stay and remain housed. The next big system partner is criminal justice. This is another area of cycling, like we've talked about. Folks are arrested sometimes just because they're on the street and they're homeless, they're going to jail, they're returning out of jail with no place to go, and so they're returning right back to the shelter or the streets. And so this partnership is really critical to ensure that these cycles end. And then lots of communities are really concerned about these folks re-entering from jail and where they're going to go and making sure that they have a home and that they can access housing, because we know criminal backgrounds is something that has been a barrier. So it's important for the criminal justice system and the housing system to work together to really help folks get housed. The last three on this slide are tribal nations, community organizations who are led by or for Black, Indigenous, and Indigenous people of color and people of lived experience. So one of the main things that holds these three groups together is really ensuring equity in voice and in the execution of ending homelessness. So what are the ways we're addressing racial disparities? So all three of these groups are really experts in these specific populations, and we really need their partnership to understand and address the main barriers for these populations. We need to develop meaningful partnerships with them and programming and strategies that can be implemented in an effective way. And often these programs and strategies need to be implemented by these organizations themselves. So it's very important to raise their voice and ensure that we're adding more resources for these populations and partners and targeting those resources, because they are often the best ones to implement that programming. With tribal nations, I think the one thing that's unique about them is that they've really faced a bureaucratic hurdle, if you will, since this is one of the first years that tribal nations can get ESG funding, for example, directly, and COC funding directly. So for a long time, they've just been unable to participate in these funding sources in order to develop programming for their population. So these aren't the only partners in addressing homelessness. So I had you think of three partners to end homelessness. And as you can see, there's really a vast number of partners who can help us end homelessness. So hopefully your three partners that you listed will fit in one of these categories, because wow, there's a lot of different partners to end homelessness. And as I mentioned before with the COC concept, is that COCs and partners look different in every place. You may go to hear about one location and they're very connected to local law enforcement. They have police who are on their COC board. They're actively working with folks and homelessness. And other places, that connection might not be there. Same with healthcare, often with workforce development too. So the interesting thing about homelessness and ending homelessness is that your partners look different based on what the needs are in your community. I did want to touch on a little bit of how this partnership and these interactions can work together. So you've probably heard us mention HUD a number of times. So much of the funding that we utilize to end homelessness comes from HUD. So ESG, ESCV, COC, all this alphabet soup of funding originates from HUD. And what HUD does is they work with other often government entities like the state of California in order to allocate funds. So the state of California receives funding from HUD, and then they need to determine what's the best way to utilize this for the state and how are we going to allocate these funds so they're most effective. And what the state of California has been doing is they've been, passing a lot of these dollars to the continuums of care to look at what the local needs are and what providers can receive this funding in order to move the needle on ending homelessness. So they're executing grants for services. And so these grants go to service providers. So some service providers may be providing like street outreach services to people who are unsheltered and working with unsheltered folks in order to get into housing. So when that person's they come up on the list to receive housing, the service provider is working with a housing provider to find, and the housing provider is locating housing for that particular participant. So housing providers, and we cannot provide housing without landlords. So there's a lot of work in the homeless system right now about working with landlords and having landlords understand what are some of the unique needs of people experiencing homelessness and how they can be a partner and an ally in keeping people housed. And so once they're housed, the housing provider is working with them to stay housed, be a good tenant, have housing stability, and good retention and housing so they don't ever become homeless again. Like Mindy mentioned, most folks don't become homeless again. And really an overlay with this, one example is mental and behavioral health. So folks experiencing homelessness, as I mentioned, often have like a team working with them. And so even when they're on the street or unsheltered, they may have a mental health provider working with them and their service provider. And this relationship would carry through with them until they enter into housing. And so they still may have their behavioral health provider as well as a case manager. So this is kind of one example of how the partners can work together to end homelessness and to understand what the needs are in that community. So one specific group we want to talk about, which is really critical to ending homelessness, is people with lived experience. And so for some of you, this may be a new term. Some of us might just be calling people homeless as a blanket term, or people who were formerly homeless or things like that. But really, most of us in the homeless sector are using persons with lived experience. And so the really critical part is developing a meaningful partnership with people with lived experience. And what does that mean exactly? I mean, for me, it really means like, how do we have meaningful and productive engagements with people with lived experience? So this includes how we're treating them in a meaningful way, how we're compensating them in a meaningful way, because they're giving us their time and their experiences in order to help us understand the system. But so we have to make this a meaningful way. And people with experience many of them are very excited and engaged in helping end homelessness in their community. And the nothing about us without us sometimes for me feels like a battle cry. When I was working with young people, they would say this all the time. Like when some folks that were older in their 50s and 60s, I never heard them say this, but young people were like, don't make decisions about the homeless population, about young people without us. So they feel their voice is critical in not only input. So we don't want to meaningfulness is not just asking them what they think, but meaningfulness is also about decision making. So we want to have people with lived experiences in places throughout the homeless system where they can make decisions. I mean, that could be on a board. It could be about making funding. It could be developing the application that people are using to have funding. It's also understanding how we can make things better. Some of the best ideas that have been implemented in my time working in homelessness have come from people with lived experience. So when we think of things like low barrier shelter, so a place that someone could bring their pet or their partner and all of their belongings, no matter what they look like, is something that people with lived experience said, because we go out and we're like, what will help you come off of the street? And they're like, well, I can't bring my cat with me, so I need a place where I can bring my cat. And I need a place that has different rules, right? So there's too many rules here. Another example I have is like navigation of the system. So understanding how to get into housing, the people who who can get into housing on their own. So the folks that don't need someone to help navigate with them. So we wouldn't have known that people need a navigator or someone to help them through the housing process unless we talk to people of lived experience. One of the main points that I think is so important is the training and support. And this is not a one-time training and not a one-time piece of support. Folks with lived experience really want to be engaged. They want to be knowledgeable. They want to show their expertise in the system and how things work. So this really starts with the identification and the recruitment for me. So just because someone's articulate and they seem stable, they might not be the best choice to be a representative of lived experience. So you really have to have them to talk with them and have them understand what your expectations are, what you want them to do, what their time commitment is going to be. And part of that is going to include the onboarding they need to understand. Just because they experienced homelessness doesn't mean they understand even all the things we talked about in this session, like how it's defined, what are the interventions that help them. And so onboarding is really important. I've also found that preparing people for meetings pre and post is really important too. So I often met with people that experienced before the meeting, so they knew what to expect, that they understood the agenda, they understood what kind of questions might be asked, and then afterwards, because it's intimidating to go into a new room with people you don't know and be looked at as an expert. And so often I would meet with them after the meeting to just see how did it go, were there things they didn't understand, were there things they would have liked to say that they didn't feel they could say, and how could we empower them to say things in the next session. So those parts are really, really important, because I have found that if you're not taking the time to create a meaningful partnership, to compensate folks, to train them, and to check in with them, really that experience is less and less meaningful, because they don't want to stay engaged with that, right? It's like if you've ever been, if someone asked you to go play like baseball and you've never played before, and they throw you a glove and they're like, here you go, let's go. And you're like, what do I do with this? You're probably not going to go back and play another round, because you're just like, no one helped me get through this process in the first place. So with that, we're going to move to one thing that I think people think are really important to ending homelessness is performance and benchmarks. So performance and benchmarks, even in my experience in working in the sector, have evolved over time. So we're going to start with HUD system performance measures. So the thing to note first is that this is for the system. And so this is a systemic response. So we're not looking to, some of these, we do not look to pass these down to individual agencies to see how they're performing. So this is, again, this collective work and shared goals across the system in order to ensure that we're addressing and ending homelessness. And so these goals also, we need to look at them across all funding streams. So it's not just this is a goal for the ESG funding stream or for HUD, but we all need to look at these in a collective way. The other thing before going into them individually, I would say, is like the important thing, and what I think HUD has learned over time, is that these benchmarks are really local in nature, and that HUD does not set like a national benchmark and say, you should have this % of folks doing this, that they look at this as progress over time in the local level. And so you should look at these performance measures as, how are we doing from this year to the next year to the next year, in having things move in the correct direction. There's actually 7 benchmarks, but we only talk about 6 of them because the 7th one, HUD does not allow anyone to give their performance on. So if someone asks you in a HUD trivia contest how many performance benchmarks they are, just say 7, even though we'll only talk about 6 today. So the first one is first-time homelessness. And so we look at how many people are becoming homeless for the first time, and over time we want to see this as something that's declining. The number of people experiencing homelessness, we want to see this declining from year to year, and we look at different data points in this way. The length of time that someone is experiencing homelessness, so when they first touch the system, whether that's working with an outreach worker or coming to a shelter, to the time that they leave the system, hopefully through permanent housing, how long does that take? We want that to go down over time, because we really want to rapidly end someone's homeless crisis as quickly as possible. We know that income is essential to ending homelessness. It increases someone's stability and ability to take care of themselves by increasing their income, whether they need a subsidy for the rest of their lives or not. So increasing income in whatever way we can is really important. Retention. So as Mindy mentioned, many folks who go into housing never become homeless again. So what is our ability to keep people in housing? This also goes with housing first, right? We don't want to terminate people because of some rule breaking or something that, we want to keep people housed basically. So high numbers in retention, and then returns to homelessness. So when we do have someone leave the system or exit a program, we don't want them to return back. And so we want this percentage to be a low number and as low as possible. So the state of California has also started talking about what kind of measures they want to look at in addressing homelessness. And so the action plan for preventing and ending homelessness in California is, I think, a relatively new document. And so and many of these measures you will see look very similar to the HUD measures. So how many Californians are sheltered or unsheltered at any point in time? How many continuous care are increasing the number of COCs having increases versus decreases in the number experiencing homelessness? How the number of people spending time in shelter and transitional housing. So those are interventions we want to see fewer and fewer people in. How many Californians are experiencing homelessness for the first time every year? And then moving on to how many have exited successfully every year. Again, this idea of successfully having permanent housing, how many are returning to homelessness. California has a specific measure about the number of children and youth experiencing homelessness during the school year. So back to Mindy's point of that, the homeless definition does have one specifically for education, and there's a lot of resources for that. And how does California's performance look across these measures based on regional and national trends? So unlike HUD, California is looking at how they're doing in comparison to their neighbors. And thank you. I'll turn it back over to Chris.
Thank you, Karen. Thank you, Mindy. And thank all of you for attending this California Housing and Community Development training session offered through the Emergency Solutions Grant Coronavirus Consulting and Staffing Services contract. Please note that this training series features over a dozen sessions that you can view at your leisure.